Broadcasting from the Dixon Petunia Festival Sweetland Studios, this is Along the Rock.
Hello again and welcome to another edition of Along the Rock. It's our podcast that pays homage to the people of the Sauk Valley and the river that runs through it. My guests today are both from OSF Healthcare, which of course has now joined forces with KSB Hospital. The name has changed, but not the mission. AJ Querciagrossa is Regional CEO of OSF Healthcare. Jackie Kernan, to his left, is OSF Healthcare's President of Saint Katherine Medical Center, which is now, of course, what the former KSB used to be called.
Yeah.
So, welcome.
Thank you very much.
Appreciate you coming up. As we started talking before we started recording, change is never easy, is it?
You know, change is, I think, inevitable in times. And I think, you know, we're really just excited to be in the community, and we're still learning a lot. And I'm personally thankful for all the individuals who have just, you know, welcomed us and have been just so appreciative of OSF and, you know, what we're going to continue to try to keep doing as we move forward on behalf of the community.
Sure. Put things in perspective, AJ, if you could, in terms of size. What is OSF's umbrella look like these days?
Sure. I'll help you with OSF because that always gets everybody. Everybody always
I don't know what it is.
Well, it's going to be easy. Order of Saint Francis. So our sisters are the Order of Saint Francis,
right.
The Third Order of Saint Francis. And, you know, for us, OSF grew from humble roots. And we've been around almost 150 years. I think we're in our 149th year now, or close approaching that. And, you know, they came to Peoria, and because of the good works that they did in the communities, different bishops in different communities across Illinois, other states asked them to come to communities. So, you know, when we were asked to come to Dixon, I don't know that it was any different than 149 years ago. And so for us today, that those pioneer sisters have grown the hospitals to now we have 17 hospitals in OSF Healthcare. And 16 of them are in Illinois and one in the Upper Peninsula of Michigan in Escanaba. So,
I can believe that they really need that kind of care up there.
Well,
it's far away from everything. You know?
Well, it is, and you know they're one of the long-time OSF hospitals, and so it's always, if you think about the 1800s, I always am, how did the sisters actually get there? And so I'm sure it was an adventure.
Mm-hmm. Sure. Yeah, birch bark canoes. Maybe.
Yeah, maybe. They had resources to get there and a lot of prayers.
Yeah. Jackie, again, welcome to you. And you are now running OSF Healthcare, Saint Katherine Medical Center, and you have for a while it was another 2 hospitals that you were running. Yeah. Now it's, I guess, just another one. But tell us about that.
Correct.
How that takes up your time.
Well, it does. Yeah, I came to OSF about 16 years ago as a nurse leader. I'm a nurse by background, and I was at St. Luke in Kewanee, which is the other hospital that I have the pleasure to serve at. And since then, I've just been given additional opportunities and love when AJ gave me the opportunity to come to Dixon. I also served as president at St. Clair in Princeton and helped them during their integration into OSF from Perry Memorial Hospital. And so I had been through a couple of different integrations along the way and led this integration with Dave Schreiner as we were coming into KSB. So it's been a great adventure, and it does keep me busy, but I always tell AJ it's not different work, it's the same work. We're still working with our mission partners who are our employees. Sure. Of day-to-day operations and how we care for patients with the best and greatest care and love, and it's the same at both facilities. I have great teams. We were able to bring a couple of our executive team members from KSB over. Drew Fenner is our VP of operations, and he stayed with us and has great history and and just is a great executive leader. And then also Dr. Joe Welty, who came back out of retirement to serve as our chief medical officer. So we have a great team, and because I have great teams, I'm able to do two different locations. So yeah.
Dave now Schreiner, he's retired, isn't he?
He is.
He is.
Yes.
Okay.
Yeah, I would just, for us, Dave was able to serve in an interim capacity with us right after integration, and really thankful to him. And he's been in the Sauk Valley for a long time, and knowledge and expertise, and so just really thank him for the transition and all of the things that he did for OSF and KSB for very, very many years.
Yeah. I don't think anybody would argue that the mission of a hospital is a high calling. I mean, that's clear. You're taking care of people. But why is it that so many of these small rural hospitals, and I'll just use Illinois as an example, are having such trouble making ends meet?
Yeah, we've seen this happen in our communities that we serve now. Many small rural hospitals close. And, I think it's a culmination of many things. I think you have to also go back to when the hospitals, like KSB, over 100 years, they had a different person that they were caring for. They had a different purpose. It wasn't necessarily just their mission. Missions didn't change, but the economics, the people, our communities in Illinois aren't all growing. And so you also then put lack of population. We also have advances in medicine. And so when we talk about hospitals, many individuals go right to the inpatient services of a hospital. And I would say their inpatient services are really, really important when you need them. And we're very thankful that we're going to be able to continue to provide that in the Sauk Valley. But today, so much of the care of patients has gone outside the walls of the hospital. We're on an outpatient basis. Just treatment in general has changed. And, my mother, not going to give you my age, but, when we had babies long ago, mothers would have stayed many, many days, up to a week in the hospital, and now it isn't like that, as an example, for most individuals. And I think the advances of healthcare have changed that as well. But I think that's one aspect. I also do believe that, for the time, we want to get connected to advancing medicine as well. And I think that does at times put a strain on a smaller rural hospital because they might not have all of their resources that maybe a larger integrated health system might have.
Doctors are not cheap. Equipment is certainly not cheap.
Yeah, I would just say, for all of us, even in today, right, we were talking right about the world today, costs are higher, of course. Healthcare, I don't think, is any different. I think we know we will see reductions in individuals going into the health professions, specifically in physicians, but we also have other providers today, right, our advanced providers, our PAs, our nurses, pharmacists, right? A lot of the care team. I just think that there are less and less of individuals available to do the work. And, I think you've probably heard, we always equate things to the post-pandemic, but a lot of people resigned. We call it the Great Resignation in healthcare specifically, because healthcare got really hard during COVID, very stressful. Burnout. And, frankly, again, we're going to have to continue to invest in the pipeline of our healthcare teams moving forward. So we're kind of in that gap of, do we have enough clinicians? Do we have enough, we call our employees mission partners, enough mission partners to do all the work we need them to do?
Okay, well, does that then equate with the number of clinics that are now popping up seemingly everywhere?
Well, I would just say, as AJ was talking about the changes, but also our age of our demographics is getting older too. So, and our care is moving, like AJ talked about, home or to the ambulatory clinic. So as you talk about, we're seeing those pop up more and more frequently. And also our millennials, they don't want to come to the hospital for care if they can avoid it. They're going to go to those outpatient clinics for care when they need it versus having and forming a relationship with a physician.
Or telemedicine.
Yep, or tele.
Some people don't like talking about that because I think they see it as, well, I'm just sitting there talking on my computer, and some guy's, sitting there, he may be paying attention to me or not.
Right.
But there is special training for that, I've got to think.
Well, I would say it's another offering in the toolbox of healthcare, right? It's not going to be for everything, but back to your clinic piece, our goal is to keep care local. It isn't around to take patients out, but there will be times where patients might have to go seek treatment for something that isn't being done locally in larger metropolitan cities or neighboring communities, just because that's the nature of those specialists, right? We need to have enough individuals to serve to keep the training, the quality, the competencies of those physicians and other providers. And so when you see other clinics, you see them in maybe smaller communities. Those are really our core access, those primary care connections in our community. I think that'll continue. But also you think about the aging populations and think about, I think about my parents as they're aging. They're doing quite well right now. But as time goes on, driving, so a televisit for certain things might really be fine for that certain encounter. Like if the doctor or other clinician wants to just check in on mom, right, and really see how they're doing. And then there's other pieces of that it's really about digital, it's around wearables, it's around monitoring, and we'll talk about things that we're testing in OSF healthcare on the cutting edge of things like hospital at home. So even patients who might be having a bedded inpatient encounter, some of those patients who are in beds today across America can actually be served in their own home at the same high level inpatient care today. And we're testing that model.
Back to the future.
Well, again, we're meeting people where they are, I think, and adapting. And so that model in OSF is being done today in Peoria and in Rockford. And again, testing, and I do think there'll be an application of that in the future.
Okay.
4 days of nonstop fun. The 2025 Dixon Petunia Festival is the place to be this July 3rd through 6th, with concerts, fireworks, food, the parade, and much more. Full lineup at petuniafestival.org.
As you say, you've got to keep up on things, and I know as the drug industry is, of course, constantly advertising, and I don't think I'm exaggerating to say there's something new coming out every 2 weeks in various new medications. But has KSB been a teaching hospital, considered a teaching hospital, or will it under OSF?
Well, we absolutely are. They've had a long history of having residency programs at KSB and OSF Saint Katherine. We have a podiatry residency program as well as a family medicine program. So we have 2 residents in each program every year. So that helps keep our pipeline so that we can continue to recruit those physicians back to rural health.
Mm-hmm. Well, and I think that's really important because, again, I always give kudos to our current physicians who really have continued to step up and invest their own time and energy in training the next physicians of the future. And that's been done here in the Sauk Valley long before OSF got here, and we're just happy to continue to advance that.
It's not something you hear a lot about.
You don't, but that's our
hospital itself.
I would say that's just another secret investment that we're
Absolutely.
doing that we do behind the scenes, but really excited about that.
Okay. Other than podiatry, you mentioned specifically, are there plans to increase the number of training opportunities?
I think that's a great question. We would definitely like to, because our residency programs are a pipeline for all of OSF, and so having someone come through our program, we can connect them closer to their home if they want, or within our community. Also, we have training programs for anyone who walks through the door through OSF. If you come in as a housekeeper, even just 8 hours a time that you want to come into work, you can enroll into our guild program, which is free education. You can get your GED if you need it for free. You can go through nursing school through those programs. You can get your BS in finance or IT free of cost through our OSF Guild program. So that's another way that we can grow our pipeline for all those different healthcare workers that are behind the scenes doing the work every day, and our investment in them.
Well, and I think the other thing, just to add on, I think I'm really excited to continue the work that we've done with the Sauk Valley. I don't know if you want to talk about some of the programming that we're going to continue to advance there as well.
Yeah, so we do have a close relationship with Sauk Valley Community College, and so we're looking at how do we partner with them to create programs for those specialty care mission partners that we have difficulty recruiting. Respiratory therapy is one area that we're looking at. They also just kicked off an ultrasound x-ray program, and those are just really critical needs that any hospital has, not just OSF, and so we're really excited for that future. They also have a great nursing program. We bring their students into OSF for their clinical experiences as well, so we can keep training and keep regenerating that pipeline.
Yeah, get educated, in many cases for free, and then you have a career just waiting for you.
Exactly.
That's right.
A career forever, yep.
Can't beat it. Well, I wish you the best of luck. I did have one other question I wanted to get answered because I've been a patient at KSB a couple of times. And the new computer system, has that switchover happened? Is
Not
it
yet.
in the process of happening?
You know that?
Do the headaches continue?
Yeah, I would say what you're asking is OSF Healthcare is on the electronic medical record platform called Epic.
Right.
And that is actually live in all of our hospitals across OSF today. And the desire is to have KSB, now Saint Katherine Medical Center, on Epic as soon as possible. The goal, we're going to be probably on the current Cerner electronic medical record probably for the next 12 months or so. And that's just because of a contractual relationship. It's not because we don't want to do it, but we are continuing to discuss that process and work moving forward. I would say it's good and it has some challenges. The good was when we had the conversion right on January the 1st. The beauty of it is that was not a change, back to your original question, because all of the staff, all of the physicians and providers, they knew the same system, so we didn't have to mess up their cheese on that one. Okay. So I called that a blessing. Yes. Ultimately, we will go to Epic because it brings such more advancement, real time resulting, connecting to your record if you had to go to another level of care, right? It's all in one place for you as a patient. So so just hold on. It is coming, and we're committed to doing that as soon as we can.
I'll express my ignorance here, but does that play into the coding operation as well? That system?
Yeah, not necessarily on the coding, unless we're talking about the how we bill claims and things like that. I mean, the billing is all going to be set up in advance of any kind of a conversion. But today, all of our current billing and coding, we just had a meeting today about that, and all is A-OK with bills getting out the door now, and we're really excited about that going forward too. So really, we're in good hands. We talked to the gentleman leading that, and very proud of the work that he and his team are doing.
All right, good luck. Keep up the good work.
Thank you so much.
Thank you, AJ. Thank you.
Thank you.
And I'd also like to thank, as I always do, the crew here for making this program a possibility. And hope you can join us next time and many times thereafter along the road.